to join with my computer just so I can share a couple of things, although it may not be important. Let me see. Give me about 30 more seconds. If I can't join, then we'll just go through my audio. Thanks for joining us, everyone. Okay, good. It looks like I'm on. Okay, Sim. Just so I can share my screen. Okay, great. Okay, hopefully you're able to see my screen. And you see the agenda there. Does that look okay, Sim?
Yes, we can see it.
Okay, perfect. Thank you. So we'll just go through the case counts and hospitalizations. As many of you are probably aware, we achieved our transition to move into the red tier. That was announced yesterday. I'll try to explain what that means. I'll talk about a new metric that's going to be introduced later today from the state. It's called the equity metric, and what that might mean for our medical providers and our patients. We'll just remind everyone about the flu clinics and give everybody a chance to answer or ask any questions related to flu vaccinations. I'll share a really great site called CDC Science Updates, and then we will round out the rest of the hour with just updates about the testing order. For those of you that have to jump off and want just a capsule summary, the testing order is basically finalized in the version that you saw last week. We really don't expect to make any significant changes to that. So please check your email from Sim last week. We will sign that on October 2nd, which is this Friday, and it will go live on October 5th, which is next Monday. So as of next Monday, we will be requiring primary care clinics to offer COVID testing. This will be accompanied by just a big packet that will share resources, best practices, FAQs, any leads and information that we have about good labs to work with if you have a question about that. And throughout the month of October, probably on Wednesday afternoons, we will offer just office hours with myself and some of the colleagues here at Public Health who have done just a fantastic job helping to create this order so that we can just work with you. So we'll just call that office hours with the Public Health Department, and we can work with you one-on-one or in small groups, or we can talk to your staff about any questions that they have related to this order. We really want this to go smoothly. We want this to be as stress-free as possible. We know that it's an expansion of your practice in some cases, but we really feel confident that our medical community can take this on, and ultimately that it will serve the general community throughout our county, especially as we start to open up different sectors, including schools. So that's kind of our vision for October, is that we are going to be kind of in training wheels throughout the month of October, and we want to learn from each other, and we want to hear from you about how things are going and any difficulties that you might be having, or whatever other feedback you have for us about how to make this order successful before we are in the thick of flu season, which is coming right up. And then I'll just share some swabbing videos for those of you who are perhaps intimidated by doing the swabbing or just don't even know where to start. I have never seen a self-swabbing video. This is why I wanted to share these videos, is to just show you how simple and easy this can be. I know that early on in the pandemic, it really felt like you had to be an astronaut, all dressed up in the gear and really have a biohazard suit in order to get the swabbing done. While you do have to maintain some cautions whenever you're interacting with patients that potentially could have coronavirus. And when you're doing the procedure, it's definitely doable. And the self-swabbing just makes so much sense if you're limited by PPE. That's really what I would recommend doing in almost all cases. And we'll show you a couple of videos that really walk people through doing that. So we'll end with those. All right, let me go through the case counts. I'll just verbally go through them. I think that for those of you who do follow these numbers, they're pretty easy to find. If you don't follow the numbers, then maybe this is not as interesting to you. But as of today, we have registered 28,126 cases in the county out of a total of 287,000. So that represents 9.8% that have tested positive ever since March. So one question that we get is why is the testing positivity so different when we report it versus when the state reports it? Well, the state reports just over a 7-day interval of what is going on just most recently. And most recently, our testing positivity has come down. It's almost half of what it was before. So our overall testing positivity since March is 9.8%, but more recently, our testing positivity is closer to 5%. It's actually 4.9%, which really puts us in a good position to move ahead in terms of the blueprint for the economy. But that's kind of why those numbers don't really add up. We also get a question about why the total number of daily cases are different. And I wish I had a better explanation myself. Dr. Kokumar, if she's on, may be able to explain that. But again, it has to do with the fact that the state looks at a different time interval than the county does whenever we do our dashboard, and that's why the numbers don't really align. In any case, it's really the state's metrics that allow us to move forward. And so we are officially now in the red tier because that's what the state's metrics mandated, or I guess suggested. We do have 390 deceased patients, and that number is reflective of all of the death certificates that have currently been registered. I think we're almost caught up for what it's worth. And so hopefully we are seeing a slowdown in the fatalities as well. But again, you know, this changes all the time. So that's why we try to update it as soon as we can and as frequently as we feel comfortable with the numbers that we process. There's a lot more information on the dashboard of our county website if you're curious just about additional surveillance, do a deep dive into the fatality cases and review of the statistics related to the mortality, and then obviously a breakdown by things like age and ethnicity. In terms of the hospitalizations, that number is also coming down nicely. And we're now in the 70s in terms of the number of hospitalizations across the county. Today it's actually 80, and that includes hospitalizations in the general medical floors as well as in the ICUs throughout the county. And that's also accounting for 23 ICU patients. The number of available ICU beds is still really low, meaning that we are operating at a pretty high capacity. But our hospitals are telling us that that their census is about what is expected for this time of year. And I'm happy to hear from anyone if you have any comments about that. So we're hoping to keep those numbers low, just because as we go into flu season, we know that we can expect an increase in respiratory illnesses, which would warrant hospitalizations. And we really want to protect our medical system by minimizing the number of coronavirus and influenza cases this year as much as we can. So that's why all of the safe practices are still very important. Even though we're now in the red tier, it's still important to just be very mindful of all of those safe practices for the general public, and then to really make sure that our healthcare workforce is protected, just because we're going to need all of them in order to get through this winter season. Red metrics and state blueprint actions. Let me just see if I can switch over to this screen so that you can see the red metrics. But basically, this is from the state's website. It basically breaks down, it's a table that shows, what's allowed in each tier, and the tiers are divided by color. So we went from purple to red, and that means that we are able to open up several different sectors and then expand other sectors. So retail can go from 25 to 50% capacity, and shopping centers like malls and swap meets can go from 25 to 50% capacity. Indoor activities which were previously closed, like museums, zoos, aquariums, places of worship, movie theaters, fitness and gyms, fitness centers and gyms, and restaurants and diners. All of those can now open indoor operations, but only at a limited capacity. For example, for gyms and fitness centers, it's 10%. For diners, movie theaters, et cetera, it's 25%, and places of worship. So they really can't be up at 100% capacity at all. They can't even be at half capacity. They really need to have very sparse seating indoors. One good suggestion that Sacramento County is adopting, which really makes a lot of sense to me, I wish the state had done this, is that they're asking people, if you're going to have an outing with people from your own household, then you can do that indoors. And if you're going to have an outing with people that are not from your household, then you should really still stay outdoors. And that's really great. That means at a restaurant, if you're going to go out to dinner with people from your own household, you can go ahead and do that indoors at the restaurant. But if you're going to meet up with friends or have a work meeting over dinner, then you should still do that outdoors. And that makes a lot of sense to me, just intuitively, because that means that you're already interacting with people from your household when you're at home. And so the risk is not that much higher whenever you have dinner together, sitting together in a restaurant. But if you are going to meet up with people from work or other social sort of contacts, then your risk is actually high. And it's even higher because you're not going to be wearing a mask when you're having dinner, for example, or spending a long time together, like in a house of worship or at a movie or something like that. And so therefore, you may want to just consider doing that outdoors. Again, that's not a requirement. That's just something that one county is doing, Sacramento County, but it makes a lot of sense. So just think about things from that perspective. We'll see if we can nudge our own local businesses to kind of follow those guidelines. We're just hoping that they abide by the percentage capacity limits that we have here, because hopefully that will mean that we have a very slow reopening. It's really not reopening, up to 100% or even 50%. It's a very slow and stringent reopening, and it's deliberately done that way because we want to make absolutely sure that we do it with a lot of precautions in place. Some things are still closed, like bars and breweries and family entertainment centers. They still have to be outdoors or closed. And those can be opened up later when we move into orange and eventually yellow tiers. And those are attached to different metrics that we have to meet in terms of our case counts and our case positivity rates. Let me go back to, the agenda. So there's another metric that's kind of coming down the pipeline called the equity metric. The state wants to introduce, some kind of a measure to make sure that the most vulnerable populations are getting the attention that they need. And the way that this is being workshopped, the iteration that will be introduced later today and made public is that they're breaking up the population of each county by census tract. And the census tract, I think it has to do with household income. And the census, the 25% of the census tracts that have the lowest household incomes is considered the lowest quartile. So they basically have, different quartiles according to household income. And the lowest quartile of all of the census tracts in a county are going to be required to have, they have to meet the metrics in order for the county to progress to the next level. So let me try to explain that in a better way. I know that was just a horrible explanation. So basically, we're in red tier right now. For us to move into orange tier, not only do we have to have the average numbers meet the orange metrics, we also have to have the lowest quartile of Fresno County meet the orange metrics. So basically, you can't just average your richest neighborhoods and your poorest neighborhoods, and if that average is, orange, then we'll move into orange. Now we have to basically make sure that our lowest quartile also meets that metric in order to move forward. I think we'll make it. I think just informally, knowing how we've designed our testing and our outreach, and knowing that, for example, UCSF Fresno has really invested a lot into the equity project, and they're really targeting vulnerable populations. We have a lot of contracts with community-based organizations to target vulnerable populations. The strike team, the Unified Support Team, it's called, which is coming from the state, is actually targeting a lot of vulnerable populations for exactly this reason. So I'm not really that alarmed whenever we hear about this equity metric, because I think we will be close to meeting it or meeting it outright by the time it's time for us to move into the orange tier. And we have several weeks to work on that anyway. So starting next Monday, the state is going to start sharing information about how we're doing on the equity metric. And so we will know how far we need to go in order to move into orange. But nonetheless, we stay in red for 3 weeks anyway. And so we have till the end of October to work on this. But I think we'll be very close, just knowing how we've kind of designed our response, and we've very deliberately invested in our underserved populations, because we wanted to make sure, not only for the purposes of this metric, but just because it's the right thing to do, we wanted to make sure that we were meeting their needs. So that's kind of how we're approaching the equity metric. As we find out more, then obviously we'll share that information, but that's something that the state's rolling out later today. All right, influenza clinics. These are still being planned, as you'll recall from last week. Here's the slide that I shared last week, which shows you all the different places where they're happening. And so the next one will be tomorrow, actually, on Kings Canyon Road at the Fresno Center. And there's several more being planned. Also, remember, we have a mass vaccination clinic for influenza on October 3rd in West Fresno at the Westside Church of God. And we will also be offering influenza vaccinations at the Big Fresno Fair. So our team is planning that. We're working with the fairgrounds to make sure that we can offer that. But in any case, hopefully your patients are getting their flu shots. Hopefully you're helping us deliver those flu shots. Hopefully your staff is working on getting their flu shots as well. It's really important for the healthcare workforce to be very well protected against the flu. And really the general population also needs to get the flu shot this year. So just a reminder, get your flu vaccine and make sure that your staff and your patients are getting their flu vaccines too. CDC science updates. So this is just a great site that I came across, and I've just been dipping back into it over and over again. This is called the CDC Science Update Library, and they basically have just a lot of different information that they release several times a week, actually. It's not even weekly, it's multiple times a week. And they basically just aggregate a ton of articles and really give you capsule summaries about all of them. So if you want to do a deep dive on any topic, you certainly can. Or if you want just a good overview and digest of all of the different things that people are researching related to coronavirus, this is just a good landing place that aggregates a lot of that good information. One interesting article that they published or that they shared today was just about how horror movies and that kind of just, I guess, morbid, what do they say, morbidly curious individuals, they actually help promote psychological resilience during COVID-19. So if you need an excuse to watch the Texas Chainsaw Massacre, it's because it will help you prepare for the nightmare scenario that we're all living through, I guess. But that was kind of an interesting scientific article that they shared today. But they also have other very serious articles that we look at. Like this one's a good one, clustering and super spreading of potential SARS-CoV infections in Hong Kong. Looking through this, they have a great investigation. They looked at 137 different recognized clusters. The median cluster size was 2, but they also found a bunch of super spreader events. And they diagrammed what these super spreader events look like. And here you see there's 4 different super spreader events that they've identified. The largest one included 106 individuals, and then the other ones included 22 and 19 individuals. And here you see most of these super spreader events are happening through social circles, which is the yellow dot. They can be from, hanging out at a bar, going to a temple or a house of worship, going to a cultural ceremony like a wedding, or just interacting through other locations. But the vast majority of these are through social circles. Work-related clusters were actually not that highly represented. So even though we spend a lot of time telling people, be careful at work, and doing a lot of investigations with occupational transmission, again, it's really just all those gatherings that are driving transmission, and sometimes driving it in a major way, which is called a super spreader event. So again, that just goes to show you how hard this pandemic is to control, is because those are the hardest behaviors to control, is what people are doing in their unregulated time at places like social gatherings. So I thought this was a nice snapshot of that. There's more and more information coming out about these super spreader events. And it just seems to be that there's a very few individuals that actually are responsible for the majority of cases in many different societies. Hong Kong, India, US, they're basically showing that a small number of people in the wrong place, usually not masking, usually in a crowded area with very poor ventilation, a small number of people actually drive a large number of infections. So that's kind of an interesting, just an interesting observation that's coming out more and more about how coronavirus seems to travel. But anyway, the CDC science updates are, again, released several times a week. They really have a lot of good information, even little briefs about how to, just little like one-page articles and things like that. So check that out. I've shared the link right here, or you can just Google CDC science updates and it comes right up for coronavirus. All right, let me switch gears and talk the rest of this hour about the testing order. Like I said, this is something that we are planning to sign on Friday. We just really want to make sure that we harmonize this testing order with some of the orders that we've put out before related to febrile illness reporting, and just make sure that we really have refined all of our different documents. But in terms of the basics of the order, you've already seen it. You've given us good feedback about it. We haven't heard any major red flags about how we're approaching this, which I guess is good, but you still have time if you are at all wanting to raise those red flags. Please let us know so that we can talk about how this will go down. But as of next Monday, this order will be live. And so we will expect primary care clinics, ambulatory care clinics that are not surgical specialty clinics to be able to offer COVID testing. Really, my rule of thumb is, if you checked people for influenza last year, you should be prepared to check people for COVID this year. So hopefully that makes sense, just because clinically those are very, very similar illnesses when they initially present. Maybe not in their complications, et cetera, but when they initially present, people sure feel very ssimilar with both of these illnesses, and they're going to come to you expecting to be tested for both. And I know, like, for example, Quest is already offering, the dual test panel. There may be other dual test panels that are coming down the line. So you should really be thinking through how you're going to be approaching those patients in your own practice. But with coronavirus, this order will apply to make sure that we have that available. And we're talking to the schools almost every day, just as they get ready to reopen. They have a lot of questions and frankly, some apprehension about how their outbreaks will be managed. And we're telling them that, this order is happening, and in some ways will serve some of the outbreak investigations that may need to be done with things like schools and other places of where people work. Just because as we reopen more things, we are going to have an increase in the number of cases, but we don't want to have more outbreaks, so that as soon as someone becomes symptomatic, they need to go home, and they also need to get tested. And so if you're able to offer testing, then some of your patients may be able to rely on you to get that testing done. If you have a partner site within your network that wants to do the testing for you, I don't really have a problem with that. We just can't rely on public health or even the OptumServe sites to be doing all of the testing for the whole county, just because that's not a realistic long-term solution. So just work with us on that if you have any questions. But some of you have expressed some comments that you frequently use an in-network urgent care site, or you have a partner site which does all of your testing for you. And again, I don't really have a problem with that as long as it's convenient for the patient and it's convenient for you and your partners to work that out. It should just be a very seamless procedure for the patient to just go get tested if you're relying on that kind of a partner site. Speaking as an emergency physician, this is really not appropriate to send people to the emergency department just to get a COVID test done. So that won't meet this mandate. But if you have any questions about this requirement or what would meet this requirement, let me know, and we'll be happy to work with you on that. We fleshed out our FAQs a little bit, so we still, and you have that as well. We shared that with you last week. Some of the information that we didn't have ready for you last week was what is the best way to pre-register patients and what is needed to register patients on site. We can certainly share what works for us because we do this all the time through public health. But really, it really depends on what your own registration setup is. And you may be able to deploy some of your medical staff to get people registered either before they come in or as soon as they come in. It really just depends on what kind of process you have in place. But really, we'll try to share some of the best practices that we have about how to do that. I think the reason that we put this in here for the FAQs is basically you can do this as a drive up. And if you want to, have people wait in the car, call you from their car, and then have your medical staff meet them outdoors and then just register them while doing social distancing so that you don't have to bring that patient into your indoor space, we're fine with that. Just, think through that. Think about how that's going to play out with your staff and what they need to get done. And what your specific situation is with the parking and things like that wherever you practice. But really, it's a time to be creative. It's a time to think about different models that might work, but also keep you and your staff safe, and also just have the patient, have as convenient an interaction as possible. The other piece of information is, what information is absolutely necessary to capture for contact tracing. And that's something that we actually have a whole packet related to that. If you'll recall, back in April, we actually mandated that patients be given this febrile respiratory illness packet, or FRI packet. That's still on the books. That's still something that we are expecting people to get. But we understand that this was a very long list of instructions. At the very end, there was a section for medical providers to fill out, and it was basically, the very basic bare bones of contact tracing, which needed to be done the day that somebody got this packet. And this was really done in response to the fact that we didn't have good testing. It wasn't fast. It wasn't very, very well available. And so we used the clinical diagnosis of a febrile illness as a surrogate for the laboratory diagnosis of coronavirus. Now that laboratory testing is more accessible, the febrile illness clinical diagnosis may be less important. However, the contact tracing in this packet is really what you will be what you'll need to fill out. We're going to take out this section about the fax information because we don't want people to fax this information to us anymore. We need you to submit it through the electronic portal that we talked about last week. So we will change the language on this. But beyond that, it'll be the patient name, the date of service, yes, COVID testing was done, and then can the patient use the phone? Do they have a phone? Can they accept text messages? Do they have an email? What's their workplace? What's their work supervisor? Do they live in a congregate setting? If they went to a gathering in the last 14 days, give details about the gathering. And that's really about it. It should be about a 3 to 5 minute interview, which gets you the information that you need to fill out and submit related to contact tracing. But you can see how important this is if the person comes back COVID positive. This is really just the most important information that we need, especially in light of those diagrams that we just shared. It's really their past social interactions and their work sites that we really have to get in touch with, just because those are the people that are at highest risk of having the infection based on a positive COVID diagnosis. So we'll be finalizing this FAQ. One last thing that the FAQ has, just to share with you while we're on Zoom, we actually have given you information about labs that we've talked to. So there's 5 labs here, and I didn't include Quest and LabCorp because I'm assuming that you already have that information if you're working with them. But Quest and LabCorp would also be really good options to think about. But if you're not happy with or you don't want to use Quest and LabCorp, these are smaller, newer labs that are frankly much more customer friendly. We've been able to talk with all these people on the phone. They really picked up the phone and we were able to talk to a human being right away. And we basically asked them, can you serve Fresno County providers? And all of them assured us that they could, that all you need to do is call these phone numbers or email these folks and just say, you know what, I need to set up a contract. I need you to send me some swab kits. And we need to talk about how the courier system will work. And they'll basically get right back to you and hopefully help you out by setting you up with the lab analytics piece. So I know that that's another potential barrier. We want it to be as low a barrier as possible. And so we're going to add this to the FAQs that we post on the web by Friday. But you should have a draft of this already that Sim sent out last week. And hopefully you or your medical staff have already started to initiate these conversations if you need to. This lab, Valley Diagnostics Lab, this is a really great staff because they actually are going to be setting up here in Fresno. Let me think about where they are. I think they're near Selma. I remember driving around because I was visiting one of the agricultural packers and I saw their actual facility. But they're here in the Central Valley. They're going to have all the machines here in the Central Valley. So we're expecting that once they get up and running in mid-October, that they will actually have a turnaround time of less than 24 hours because we'll really shave down the need to transport out of county to get these labs run. So think about that as an option. Really, I don't claim to have an exhaustive list of answers for every single situation, but hopefully we can teach each other. I'm scheduled to talk on the phone with this lab, Color Genomics, later this afternoon, just to see, get a little bit more information about what they offer. But I've already spoken with them one time before. They actually help do thousands of tests for the state prison system as well as foster farms. So they're actually they actually have a really good track record with working in the Central Valley, and they're happy to help our medical providers as well. So all of these are good labs that you can work with. If you have any questions or run into any problems, reach out to us, and we will definitely try to help you troubleshoot. Okay, I think those are all the comments I wanted to make related to the testing order. Let me just share in the few minutes that we have left, the testing videos. These are a little bit fun to watch and also very informative, just because they actually show you how to do the swab technique. So here's one. Hopefully you can see this. This is actually from the New England Journal, and this is the classic swab. It's in the nose. It's done by a medical provider who's in full PPE. And so this is sort of what I think everyone typically thinks of when they think of a nasopharyngeal swab. It's a very deep swab. It's really going way back to touch the nasopharynx. I've had this done several times. Not the most comfortable procedure. Anticipate that people will sneeze. Wow, that lady is very talented, but anticipate that a lot of people will sneeze and have a gagging kind of reflex because that's what happens. That's natural. Just give them a tissue to sneeze into, and obviously wear full PPE if you're going to do that. Now, this gentleman is going to show you how to do a swab, a self swab. And this is basically, you know, you can imagine you basically sit the patient down or you send them this link and say, watch this video before you even come to us because this is what we're going to expect you to do. Then you hand them the Q-tip and the test tube, and you basically walk them through this procedure. Then you have them walk either outside of your building or 6 feet away if you have a room dedicated to this. But basically, they're isolated. You don't have to interact with them at all. And then they swab themselves. And this actually reduces the need for PPE tremendously because you can actually just have plain gloves and, you know, eye goggles and a surgical mask, and the patient can do this. He's starting with a buccal kind of a pharyngeal swab, but then he'll also show you how to do the nasal swab. And when you talk to the labs, ask them what kind of swabs they will run. Some of them are starting to run buccal or pharyngeal swabs. Most of them are still preferring nasal swabs like what he's doing right now. And so that's what I expect most people to be able to do. And again, he's not going as deep as the first video. It doesn't look comfortable. And they do recommend going into both nostrils for this one. But again, it's not the depth, it's just touching the sides and really keeping your swab in there for a longer period of time in order to get as much of the RNA as possible from the epithelium. And then the patient is expected to put it in the tube themselves. They may need some coaching about how to break that tip off, or they can just leave it in the tube and then somebody can come along and break it off for them, which is pretty low risk as long as it's done carefully. And that's all it takes. That's the self swab. So that's what we expect most of the testing to be done as, is self swabbing. And they can watch a video so that you can show them how to do it before you do it. With some patients that are good listeners, you can just talk to them and tell them how to do it without watching the video. The third one that I wanted to share, is how to do kids. And basically, this is something that parents can be taught to do. Again, watching the video may be an easier thing to do than actually explaining it. But this is a 4-minute video, and I'll share links to all of these. This is a 4-minute video which kind of walks people through how to test their kid. This is a home test kit that they use in the UK, but the concept is the same. That, you know, the parent is expected to do this for their kid, and hopefully it will be less traumatic than, you know, having a stranger do this to them. So as we get ready to reopen schools, it wouldn't be a bad idea, I think, to just share this with the schools too. So we'll probably do that too, just so that parents and teachers and people that work with young children understand how all this is done before they actually have to do it. But again, we're really trying to think ahead about, you know, what scenarios will come up more frequently so that we can prepare everyone to do this. And if there's anyone that has any best practices about how to swab kids or, you know, skittish adults, we'd love to hear it. Again, this is just another procedure that the more you do, the more comfortable you feel. And it's, you know, there is an element of trial and error with this, but hopefully it won't be too traumatic. Any questions or comments? I'll just keep this playing, but I think we can open up the phone lines if anybody has any questions or comments about any of this testing. Just do *6. I'm not looking at the chat, sorry. So Sim, if there are any chat questions, you may have to relay them.
So Dr. Vohra, there's one question from the chat. What is Fresno County's stance on starting to allow inside visitation in SNFs if using masks, physical distancing, infection control practices, and a private area to visit?
Yeah, that's a good question. You know, I've always been a proponent of allowing it, but I understand that, you know, this is actually up to a lot of the licensing agencies and the FCDPH. I know that outside visitation has recently been not only approved, but sort of required, I think, at the federal level. And I know of some skilled nursing facilities which are setting up outside visitation. So I totally agree with you that the air quality is not optimal, but having said that, I do think that outdoor visitation is still lower risk than indoor visitation. And so once the air hopefully clears up a little bit and the good weather persists, the outside visitation makes the most sense for the skilled nursing facilities, where you can actually move people out to a patio and just have nice open air, and then their families can visit them and do social distancing and masking. So to me, that's the lowest risk. I think if they are going to do inside visitation, they have to have no active outbreaks going on, and then all of these other things that you mentioned in your question still have to be maintained. So I hope that answers your question. Again, I'd be okay with doing it. I think that you know, you want to make sure that you don't have any outbreaks going on at the time, and with the other things in place. I think that would actually probably help the mental health of the residents as well as their families quite a bit. This is a great question. With drive-through flu shots, do you ever worry about the driver fainting while they're driving after the shot? So that's a great question. You know, I think if they are going to have like a vagal reaction, it's probably going to be pretty immediate, like within the first minute or so after receiving the shot. I think that the shot, you know, doesn't really trigger any late reactions unless it's allergic reactions, and even then, it wouldn't necessarily cause fainting. Allergic reactions are frankly very rare with vaccinations. More frequently, you may have some local pain or even maybe a mild low-grade fever with some vaccinations. But if they are going to have just a really adverse kind of fainting reaction, it would be within the first minute or so after they get the flu shot, just because of a fear of needles or whatnot. So provided that they can be observed for, you know, at least a couple of minutes in the parking lot before they drive away, I think it would be pretty lower risk. So, you know, I think it's a good consideration, definitely a great question. Hopefully it won't happen either with the flu shot or with the drive-up COVID testing that we're doing more and more of. But that's all the more reason to kind of watch people for 5 or 10 minutes after they do their shot before they drive away. Next question. At our county mass vaccination clinics, we ask all clients at the end how they feel. If anyone feels poorly, we pull them aside and call the lead vaccinator to check them out. That's great. So that's Naomi from our public health emergency preparation team. Thanks, Naomi. I think that answers Kelly's question even better than I could. So I really appreciate you chiming in there. And you know, Kelly, if you want to observe or pick our brain and just talk to our mass vax team, please reach out to us and we can put you in touch with them. But you know, we're more than happy to have people help us or come observe at one of our vaccination clinics that we're doing, so that you can kind of get a sense of how to do it yourself.
And Dr. Vohra,
oh, go ahead.
Today's the last scheduled date for these meetings. Is there a date that you want me to schedule them out for?
You mean for this medical providers meeting?
Yep.
I think if it's okay with everyone, this slot works pretty well for me. Most days, there's just 1 week out of every month where I have a conflict with the Wednesday 2 p.m. slot. So that's why we always kind of move it to a Thursday on those days. So yeah, I think we'll just go ahead and schedule them through. We may change the format a little bit to talk about something besides coronavirus, if that's okay with everyone, and really kind of focus on other, issues of, I think, public health importance, whether that's infection prevention, just with other diseases. We can even talk about really interesting stuff like rabies and West Nile virus. As you know, I have a personal interest as a toxicologist in things like substance use disorder and opioid use disorder. So I'd really like to share best practices about that, because those are epidemics that unfortunately are getting worse instead of better in the era of coronavirus. So I feel like this is a very valuable way for all of us to stay in touch and just bounce good ideas and good questions off of each other. And so I think we will go ahead and continue it. At the same time, we really do want to offer those office hours for those who need them, so that they can have some personal one-on-one time between our public health team and the medical staff that are being asked to do this mandate. So we really want to set aside some time to do that as well. So we may have other stuff that we need to cover during these hours. But this has been just a really good way for us to communicate with our medical community. I know that the Fresno Madera Medical Society has really appreciated being part of this conversation, and then they're actually preparing podcasts related to these meetings and based on these meetings. So I think we'll just continue them if that's okay with everyone. But if there's a better way for us to do this or a different format, then please suggest it. We're more than happy to take your ideas. And Deborah Christian says that SNF visitation is actually the subject of a webinar that starts in 7 minutes. Thank you, Deb. Oh my gosh, always in the nick of time, Deborah Christian. Thank you so much. So that webinar is actually in the chat box. It's hsag.com/cdph-ip-webinars. And they will actually talk all about SNF visitation from the CDPH. So that's great. Thank you for discussing that. That actually will hopefully take care of the SNF questions that were raised just a few minutes ago. And then we basically just have a really good thumbs up for consolidated medical bioanalysis. So that's one of the labs that is on the state testing task force website, and they have been great for testing, and they provide fast results. So that's good to hear. I'm glad that people are having good experiences with the labs and the turnaround times. All right, well, I think we're almost out of time, and just to get ready for the next meeting, I think we will adjourn and let you go if in case you want to join that next meeting. But thanks everyone for your feedback. We really appreciate it. And like I said, look for us to announce this order getting signed on Friday, and then we will expect that starting next week, we'll have a lot more to offer our patients and the county in terms of the ability to test for COVID with all of our primary care practices. All right, thanks everyone.
Thank you.
Take care. Thank you, Sim.
Thank you, everyone.